Hi, my name is Brittany Billmeyer, and I'm a Cedar Crest College nursing student. This is my discussion of my critique of the research article titled Effects of Music Therapy on Anxiety of Patients with Breast Cancer After a Radical Mastectomy, a Randomized Clinical Trial. The problem this study looks at is that breast cancer and its treatments may cause severe psychological disorders for patients, anxiety being among the most common of these psychological disorders. This study questioned if music therapy would be an effective means of decreasing anxiety after a mastectomy. This is significant for the very fact that breast cancer is among the highest in prevalence of cancers in women around the world. For nursing practice, if music therapy were to be proven effective, it could be used along with other practices to aid in decreasing anxiety among patients. This study used Lydia E. Hall's CORE, CARE, and CURE model as the theoretical framework of the study. Lydia divides the entire treatment process into two stages, the acute and the non-acute. When the patients pass the acute stage while they receive intensive medical care and multiple diagnostic tests, they enter into the next stage of non-acute recovery, which is conducive to learning and rehabilitation. The patients are represented by CORE, CARE, and CURE. In this clinical trial, female breast cancer patients following radical mastectomy were in the second stage of illness, the non-acute. The research used music therapy as an intervention to attempt to decrease anxiety in these patients. The researchers describe, by implementing music therapy following radical mastectomy to reduce anxiety, patients could control their own feelings, motives, goals, and ultimately exert their self-potentials to the greatest extent. Thus, the goal of rehabilitation can be achieved successfully. Variables of the study include music therapy as the independent and anxiety level as the dependent. These can be further broken down into preferred music, an independent variable, the volume of the music, an independent variable, headphone use, a research variable, hospital stay and therefore the length of therapy, an independent variable, time of day therapy was implemented, a research variable, length of each session, an independent variable, patient adherence to the therapy, an independent variable, control group results, a research variable, the media library, which patients could choose their own music from, an independent variable, the repetition of the music, an independent variable, and the results of therapy, the dependent variable. A convenient sample of breast cancer patients was recruited in the study according to the inclusion criteria. Female, aged between 25 and 65, with a pathological diagnosis of breast cancer requiring radical mastectomy. Patients were excluded if they were allergic to sound, had a voice sensitivity of epilepsy, or if they did not prefer to listen to music. It was determined that 100 patients would be needed for the study. A 20% increase was added to allow for a 20% decrease or dropout rate. So 120 female breast cancer patients were recruited for the study. The study was reviewed and approved by the appropriate Human Research Ethics Committee. All participants received an explanation of the study before participating. And along with this, all participants also gave written informed consent before their voluntary participation. Data were collected using a standard demographical data questionnaire, along with the State Anxiety Inventory, or the SAI. The demographical data questionnaire includes a total of 15 items, such as age, occupation, education level, residence, monthly income, marital status, and the age of first suffering from breast cancer. All patients were asked these items on the questionnaire, and the answers were documented by the data collectors, who were trained on how to complete the questionnaire and also had no information about the group's allocation. The primary endpoint was the scores of the state anxiety at the follow-up visits. Limitations for this study included self-reported data that could have been influenced by outside factors. Also, only quantitative data was collected and further study should be done on the subjective. Further study should also be done on the physical effects of music therapy, as this was not looked at. Another limitation is the experimental time compared to the routine nursing care. A final identified limitation is that ERM patients only accounted for a small portion of the population, and further study should be done. Additional limitations include the patient size. This sample size is too small to be accepted as best practice. Although researchers did not prove if music therapy could be effective in treatment of all anxiety. This study is highly specific to oncology females aged 25 to 65 that were still hospitalized following their mastectomy. However, further study needs to be done to determine if this practice can be implemented into other areas to decrease anxiety there. With the aforementioned information regarding the study and data collected, the researchers concluded that findings showed a positive effect of music therapy on the relief of anxiety in the sample population. They stated this: music can decrease anxiety by occupying attention channels in the brain with meaningful, distractive, soothing auditory stimuli, rather than stressful environmental stimuli. In this clinical trial, state anxiety of the experimental group was improved distinctly after music therapy for the post-operative hospital stay and of the following 2 chemotherapy periods. This research is important to nursing practice due to the fact that the physical and emotional comfort of our patients is a key aspect of nursing. When studies such as this bring about new or even an additional means of providing comfort, both physical and psychological, it is important that the staff, especially the nursing staff, be aware and implement that into their care. Although additional research needs to be done in order for this to be accepted as best practice, this study is a great starting point for further research and nursing practice.